My name is Dr. Nima Aniyati. I am a golf physical therapist. I've been a physical therapist 7.5 years now. Graduated in 2017 from the University of St. Augustine. Specialize in working with golfers specifically, but other active adults and athletes that want to get better. They want to feel better, they want to move better, and that they want to perform better and golf better. You know, I grew up playing sports. I played basketball growing up, I did martial arts growing up, and I used to mess around with my friends and play golf. But obviously, as we know, golf has gotten a lot more popular. And once I got my TPI certification, so through the Titleist Performance Institute, that's when I really started to kind of dive into more detail and learn a little bit more about the nuances of the game. And so that kind of helped kind of shape the direction I wanted to go with my career, which is start working with golfers specifically, because I'm obsessed with golf, so why not try to help other people that are equally obsessed? Physical therapy is super important for golfers. I think what's maybe underestimated a little bit is the initial impression of physical therapy, which there are different kinds of PT. You can go into a traditional clinic if you just have some left shoulder pain and you just want to get back to your daily activities. But here with PT specific for golf, our focus is not only on improving your pain, but working a lot towards the mobility, the flexibility, injury prevention. And I think the most important aspect is the longevity piece, which is being able to play golf for longer. And some of the stuff that you do in this type of setting in PT can apply to other activities as well, not just golf. So initially, being a PT, we want to do a lot of assessments. We want to try to get down to the root of the problem, try to figure out exactly what's going wrong and how we can fix it, right? That's the source and the nature of being a PT. So in the room and in my setup, that's where we do a lot of the assessments. You know, we'll go through the TPI screen, as I mentioned, the Titleist Performance Institute screen or some parts of it. We'll do the physical therapy assessment on the actual table itself. So really doing muscle tests, range of motion assessments, just try to get a general sense of how people are moving, and then do our treatment in the room. And so if there are limitations, if there are pain points, for example, tight muscles, there are a lot of different techniques and things that we can use as PTs to help improve that. And that's where the foundation begins, and that's where the root starts, is in the room. And then once we move into the fitness and performance side, we go into the gym. And inside of the gym, we have all of the equipment at our disposal. We have different devices that I have in office that we can use that can make it a little more golf specific, where then we start to transition to building strength, building on the flexibility, building on the mobility, and really translating that into the golf swing so that when you're hitting into the net, you're able to see or feel some of the changes that we make prior to that. So if you want to book a session with me, you reach out by phone, we'll jump on a call together. There's a free 15-minute discovery call that you and I can go over. We can chat about the details of what's going on, and then we'll come up with a plan so we can get you in for an initial assessment and dive into the details from there.